Hey everyone, welcome back to the Deep Dive. Today we are tackling something that I know you're particularly interested in,
Mm.
which is injectable treatments for knee osteoarthritis,
Okay.
or KOA for short. We know you're looking for ways to manage that knee pain,
Right.
and so we've done the heavy lifting for you. We've gone through a ton of research, multiple studies,
Wow.
literally thousands of patients worth of data to
Right.
break down what really matters.
Yeah, think of us as your shortcut
Yeah.
to understanding all the options
If
that
you've
are
seen.
out there.
Okay, so first things first, a super quick KOA refresher.
Okay.
Basically, the cartilage in your knee joint, it wears down over time,
Right.
and that leads to pain and stiffness and difficulty moving around.
Not fun.
Not fun at all, and it gets worse as we age.
Yeah, unfortunately, that's the case.
Yeah,
But the good news is there are treatments that can help.
okay.
And we've done a deep dive into 4 injectable options.
Okay.
Corticosteroids, also known as CSC,
Okay,
hyaluronic acid, or HA, platelet-rich plasma,
Oh.
PRP.
got it.
And then finally, combination therapies, like PRP with HA.
Okay, so to really kind of get the best picture possible,
Yeah.
we focused on a massive meta-analysis. I mean, this thing combined data from 35 different studies.
Wow.
Over 3,100 patients from 16 countries.
It's a global effort.
I mean, talk about a global effort to figure out what works best.
Yeah, and these weren't just any studies. They were what's considered the gold standard in medical research, randomized controlled trials.
Nice.
And plus, on top of that, they used super strict guidelines to make sure that the results were as reliable as possible.
Exactly.
Yeah.
We want to make sure you're getting the best information
Right.
to make the best decisions for your health.
Exactly.
So the studies used a couple different ways to measure how well the treatments work.
Yeah, okay.
One was a simple pain score. They called it the VAS.
Mhm.
The other was a little more comprehensive and measured pain, stiffness, and how well people could function. It's called the WOMS score. And, of course, they kept track of any side effects to make sure the treatments were safe.
Right, safety first.
Yeah, for sure. So I was thinking maybe to make all this really clear for everyone listening,
Yeah.
we can think of it like a race. Like we're going to see how these 4 treatments stack up against each other at different points in time.
I like that. I like that analogy.
So we'll look at 3 months, 6 months, and even a year out.
Okay, let's do it.
Okay, so let's start with the short-term results. What's happening at those 3 and 6 month marks? Drum roll, please.
Well, in the short term, PRP came out on top. Consistently in study after study, PRP was the most effective at reducing pain and improving how well people could move around.
Very interesting. Now, combination therapy, that's PRP plus HA.
Right.
It also seemed promising,
It did.
but it wasn't significantly better than just using PRP alone. Kind of makes you wonder
Yeah.
if it's worth the extra effort.
It's definitely a question to consider.
Yeah.
And while CSC and HA did help to some degree,
Okay.
they generally weren't as effective as PRP in that short term.
So PRP takes an early lead, but we're not stopping there. We want to find out if PRP can keep its momentum, over the long haul. Think of it like a marathon, not just a sprint.
A marathon, exactly.
So we're looking at the 12-month follow-up data.
All right.
So spill the beans, does PRP stay in first place?
It does. PRP continued to outperform the other options, even after a full year.
Wow.
And that suggests that the benefits of a single PRP injection can last for quite a while.
That's really good to know.
It is.
Now, to get the full picture, we didn't just stop at 1 year. We also looked at a study that followed patients for a full 2 years. That's a really long-term view.
That's a long time, yeah. And this is where things get a little interesting.
Okay.
So while PRP was still effective at 24 months, the difference between PRP and HA wasn't as big as it was at the 1-year mark.
Okay.
So it seems like the gap might narrow a bit over time.
Okay, so PRP might not be a runaway winner forever,
Right.
but it's still looking pretty good in the long run. But let's be real. You can't just focus on effectiveness. Safety is a huge concern, especially when we're talking about injections. What did the studies tell us about that?
Yeah, that's a critical point. And thankfully, all of the treatments we looked at were considered generally safe.
Okay.
There weren't any big red flags or major differences in side effects
Okay,
between the groups.
this is reassuring.
Yeah.
But we did want to be totally transparent about, the kinds of side effects that were reported.
Yeah.
And one study mentioned that all the treatments had minor side effects, but they didn't really get into specifics.
Right. So even though these treatments seem safe overall, it's super important to talk to your doctor about the potential risks and benefits because they can help you figure out what's best for your specific situation.
Absolutely. Absolutely. Speaking of individual needs, one study looked at the cost effectiveness of these treatments.
Okay,
Because, let's be honest, medical bills can be a real pain too.
that's for sure. Yeah, and what they found was fascinating.
Really?
So PRP might cost more up front, but because it's so effective and lasts longer, it could actually be a more economical choice in the long run.
Oh, that makes a lot of sense. Like if you're getting fewer injections over time, you're saving money in the long haul.
Exactly. And that's why it's so important to have these conversations with your doctor, because they can help you weigh the pros and cons of each treatment and figure out what makes the most sense for your individual needs and budget.
Absolutely. Absolutely. Okay, so we've covered a lot of ground here, and it's clear that PRP is a strong contender. But, this deep dive also kind of sparks some questions for me about those really long-term effects, like what happens 5 years down the line, or even longer?
Yeah, that's a really important point. We've looked at the 3-month, the 6-month, the 12-month, even the 24-month data.
Right.
But what about 5 years out or even 10 years? There's a study from 2019 by DiMartino and their team,
Okay.
and they actually followed patients for 5 years after getting PRP or HA.
Wow.
And those findings are definitely something to dig into further.
Yeah, it's like we're getting a glimpse into the future
Exactly.
of these treatments. So as we move on to the next part of our deep dive,
Yep.
that's the question I want you to ponder. What would the long-term impact of multiple injections be on joint health? Something to really think about.
Absolutely. And speaking of thinking about things, while we've covered a lot of ground, there are still some finer points to explore. For example, how do the details of PRP injections,
Oh, interesting.
like how many you get or how the PRP is prepared,
Okay.
affect those outcomes?
Ooh, I'm definitely curious about that.
We'll unpack all of that and more in the next part of our deep dive.
Yes, so stay tuned. Okay, so we've established that PRP is a front runner when it comes to treating KOA,
Right.
at least in the short and medium term.
Yeah,
But as we all know, the devil's in the details.
it is.
So let's zoom in on some of those finer points, especially when it comes to PRP.
Okay.
Now, you mentioned how many injections people get and how the PRP is prepared. What kind of impact do those details have on the results?
Well, it's like fine-tuning a recipe.
Yeah.
You can have all the right ingredients, but if you don't get the proportions just right,
Right.
the end result might not be as good.
Yeah.
And in the case of PRP, the Wang 2020 study actually dug into those specifics and found some interesting patterns.
Okay, so give me the scoop. What kind of patterns are we talking about?
For starters, they found that folks who received 2 or more PRP injections tended to have better outcomes at the 1-year mark
Okay.
compared to those who only had 1.
Makes sense to me. If one shot is good, maybe 2 is even better,
Right.
like a booster shot for your knee.
That's a great way to think about it. And it highlights the idea that sometimes a more concentrated approach
Yep.
can lead to longer lasting effects.
Makes sense.
Yeah.
Okay, so multiple injections might be the way to go. What about the preparation methods? You mentioned something about single versus double spinning.
Oh, yeah.
What's the deal with that?
Right. So picture this. When they make PRP, they take a sample of your blood and they spin it in a centrifuge. This separates the different components of your blood.
Okay.
And what we're after is that platelet-rich plasma, the good stuff that helps with healing.
Okay.
Now, they can spin it once, single spin,
Mhm.
or twice, double spin.
Okay.
And the double spin method ends up with a higher concentration of platelets in the final injection. It's like getting a more potent dose of those healing factors.
So it's like choosing between regular coffee and espresso. Sometimes you need that extra kick.
Right, exactly.
And did the study find a difference between the single spin and the double spin methods?
They did. At the 1-year mark, the folks who got the double spin PRP
Okay.
had significantly better WMX scores. Remember, that's the one that measures pain, stiffness, and function.
Right.
So it seems like the double spin method
Okay.
might be more effective.
So the details really do matter.
They do.
It's not just about getting PRP. It's about getting the right kind of PRP.
Right.
And the right number of injections.
Exactly. And it really underscores the need for those personalized treatment plans
Right.
and why it's so important to find an experienced doctor who understands all these nuances and can tailor the treatment to your specific needs.
Now, remember you mentioned earlier that corticosteroids, while they're really helpful for that short-term relief,
Mm-hmm.
they tend to kind of lose their effectiveness over time,
They do.
often by that 12-month mark. Which study was that from?
That was from a 2020 study by Saltyshev and their team.
Okay.
And they specifically looked at how long pain relief lasted.
Uh-huh.
after corticosteroid injections. They found that while these injections can be great for knocking down pain quickly, especially during a flare-up,
Yeah.
those benefits tend to fade over time.
Which makes sense. Corticosteroids are mainly targeting the inflammation. They're not necessarily doing anything to promote, like, long-term healing the way that PRP does.
Exactly. It's all about understanding the different mechanisms at play
Right.
and how they translate to those long-term outcomes.
We've been talking a lot about pain scores and cartilage,
We have.
all these, like, clinical details. But at the end of the day, what really matters is how these treatments impact people's lives, right?
Right.
Can they walk better? Can they go up and down stairs without wincing? Can they get back to doing the things that they love?
Absolutely. It's about improving quality of life.
Yeah.
And thankfully, many of the studies we looked at actually included measures of functional improvement,
Yeah.
not just pain scores.
That's good.
They looked at things like walking ability, stair climbing, and how well people could perform their daily activities.
And did PRP show benefits in those areas as well?
It did. For example, that Wang 2020 study we keep talking about
Yeah.
found that people who got PRP injections had significantly better functional recovery
Wow.
at 1 month, 3 months, 6 months, and 12 months compared to those who got HA injections.
So it's not just about feeling less pain. It's about actually being able to move better
Yes.
and get back to living life to the fullest.
Exactly. And that's what we ultimately want, right? To help people regain their mobility and enjoy life without being held back by that knee pain.
Absolutely. Now, I know you briefly mentioned a Swiss study earlier, the one that compared different treatments, including a placebo.
Right.
Did they look at functional outcomes too?
They did.
And did they use a different method for kind of assessing activity levels?
Yeah, they did. That Swiss study actually used something called the Tegner Activity Score,
Okay.
which is basically a way to measure a person's level of physical activity.
Okay.
It ranges from 0 for no activity at all
Got it.
to 10 for professional athletes.
Oh, so it gives us a sense of how active someone is in their day-to-day life.
Exactly.
Interesting. And did they find any differences between the treatment groups using this score?
Well, that's where things get a little bit more nuanced.
Oh, okay.
Interestingly, they didn't find a significant difference between the 4 groups: corticosteroids, hyaluronic acid, PRP, and placebo,
Okay.
in how their Tegner scores changed over that 6-month follow-up period.
So even though PRP might have a greater impact on pain and general function,
Right.
it didn't necessarily translate to people becoming more active overall.
That's what the data suggests.
Interesting.
It could be that other factors are at play, such as motivation, access to physical therapy, or even just overall health status. It kind of reminds us that these injections are just one piece of the puzzle when it comes to managing KOA.
That's a really good point. It's not a magic bullet,
Right.
but it's a tool that can be used in conjunction with other therapies and lifestyle changes.
Exactly. And it brings up another interesting question.
Yeah.
If all the treatments have similar effects on activity levels, would a less expensive option like HA be a better choice in some cases?
That's a really good question. It comes back to that idea of personalized treatment plans.
It does.
What's the best fit for each individual?
Right?
If someone's already quite active
Right.
and just needs a little bit of pain relief,
Yeah.
HA might be perfectly fine. But for someone who's really struggling with mobility and wanting to become more active,
Right.
PRP's potential for that longer-lasting pain relief and functional improvement might be worth the extra cost.
Exactly. It's all about weighing those individual factors and making the best decision
Right.
based on each person's needs and goals.
Couldn't agree more. One of the things that struck me as we've been kind of delving into all this research is that
Yeah.
the field of KOA treatment is constantly evolving. There's so much innovation happening.
Oh, it's remarkable how much progress has been made in just the past few years.
Oh, yeah?
Remember, PRP was considered experimental not too long ago,
Right.
and now it's becoming increasingly mainstream. And the research is showing us that there are even more ways to optimize PRP and potentially enhance its effectiveness even further.
Like those different preparation methods we talked about.
Yeah.
What other cutting-edge developments are kind of on the horizon?
Well, one area that's particularly exciting is the use of biologics.
Okay.
In combination with these injections, Okay. Biologics are substances that are naturally found in the body,
Uh-huh.
and they can help to boost healing and regeneration.
So it's like giving the body an extra dose of its own healing power. It's
Exactly.
like boosting the PRP, so to speak.
Exactly. And researchers are exploring the use of various biologics like growth factors, cytokines, and even stem cells to try to enhance the effectiveness of these injections and potentially make those results last even longer.
That's incredible, like taking PRP to the next level.
Exactly.
Love it. And it's not just about the treatments themselves, right?
Right.
There's also a lot of research happening on the diagnostic front.
There is.
Being able to catch KOA early on can make a huge difference in how well people respond to treatment.
Absolutely. Early diagnosis is key because the sooner we can intervene, the better the chances of slowing down the progression of the disease
Right.
and preserving that precious joint health.
And we're seeing amazing advancements in imaging techniques and blood tests and even the use of artificial intelligence
Yeah, it's pretty remarkable.
to help doctors identify and diagnose KOA earlier and more accurately.
It really is.
It's pretty incredible.
It's an exciting time to be in this field.
Yeah. Mm.
Yeah, the future of KOA treatment is bright, and I'm really optimistic that we'll continue to see significant advancements that will benefit patients in the years to come.
That's so reassuring to hear. Now, before we wrap up this part of our deep dive, I want to kind of circle back to the idea that, research isn't always a straight line.
Right.
Now, you had mentioned that Swiss study didn't find a difference between the treatments
Mm-hmm.
in terms of pain relief.
Right.
Were there any other studies that kind of showed conflicting results? Because it's important to acknowledge that things aren't always black and white in the world of science.
Oh, you're absolutely right. Research is all about piecing together a puzzle.
Yeah.
And sometimes those pieces don't always fit perfectly at first glance.
Right.
One of the challenges of synthesizing research is that there is always going to be some variability in the findings.
Yeah.
Different studies might have slightly different populations, use different methods, or measure outcomes in different ways.
Yeah.
And those nuances can sometimes lead to different results.
So while most of the research points to PRP as the most promising option,
Right.
there are a few studies that kind of muddy the waters a bit.
Yeah, exactly. For example, there's a study called the RESTORE trial.
Okay.
It was a large, well-designed study done in Australia, and they published their findings in 2021.
Okay.
They compared PRP injections to saline placebo injections.
Okay.
And surprisingly,
Right.
they didn't find a significant difference between the two groups
Wow.
in terms of pain relief or cartilage volume changes at the 1-year mark.
That is surprising, especially given the positive results that we've seen in so many other studies.
Right.
Do you have any thoughts on why their findings might have been different?
Well, one possible explanation could be the type of PRP that they used.
Okay.
They chose to use leukocyte-poor PRP, which means that they removed most of the white blood cells from the PRP preparation.
Okay.
And some researchers believe that those white blood cells actually play a crucial role in the healing process.
Interesting.
So it's possible that their absence might have impacted the results.
That's fascinating. So even within the category of PRP,
Right.
there are these subtle but potentially important variations
There are.
that can influence the outcome.
Exactly. It highlights the need for ongoing research to fine-tune these techniques and figure out what works best for different types of patients.
It really does. You hit the nail on the head.
Yeah.
It's an evolving field. There's still so much to learn.
Mm-hmm.
And that's why it's so important to stay curious, stay informed, and keep those lines of communication open with
Exactly.
your healthcare providers.
Absolutely.
I couldn't agree more.
Yeah.
And speaking of communication, I'm curious to get your perspective as an expert who sees this firsthand.
Yeah.
What do you think is the most important takeaway for someone who's considering these injectable treatments for KOA?
I think the key message is to approach this decision with a realistic and informed mindset. These injections can be a valuable tool in managing KOA, but they're not a magic cure.
Right.
It's crucial to have realistic expectations and understand that results can vary from person to person,
Yeah.
depending on individual factors, the specific type of injection used,
Ah.
and the overall treatment plan.
And to echo what we've been saying throughout this whole deep dive,
Right.
open and honest communication with your doctor is absolutely essential.
It is.
They can help you weigh the pros and cons, consider your individual circumstances,
Right.
and ultimately guide you towards the best decision for your long-term health and well-being.
I couldn't have said it better myself. And remember, the learning journey doesn't end here.
That's right.
Stay curious,
Yeah.
ask questions, and don't be afraid to seek out multiple opinions.
Yeah.
Your health is worth it.
It is. Okay, so we've covered a lot of ground,
We have.
but there's still so much more to explore.
There is.
In the final part of our deep dive, we're going to take a closer look at those long-term implications
Okay.
and the future of KOA treatment.
Sounds good.
So stay tuned.
Okay.
Okay, so we've explored, the pros and cons, the short-term and the long-term results of these treatments, even the nitty-gritty details.
Right.
But now I kind of want to look ahead. What does the future hold for, people who are dealing with KOA?
Well, it's the million-dollar question, isn't it?
It is.
And while we don't have a crystal ball, the research gives us some clues about what might be on the horizon.
Yeah, so let's put on our futurist hats.
Okay.
Gaze into that crystal ball.
Right.
What trends are you seeing that kind of give you hope for the future of KOA treatment?
Well, one thing that really stands out is the continued focus on those long-term implications. Researchers are digging deeper, following patients for longer periods to really understand how these treatments impact joint health over time.
Yeah.
It's like we're putting together a giant puzzle, and each study adds another piece.
Yeah, it's like we're building a roadmap for the future of KOA care. And it's not just about the physical effects.
Right.
It's also about understanding how these treatments impact people's lives as a whole, their emotional well-being,
Absolutely.
their ability to work, their overall quality of life.
You're absolutely right. Those aspects are just as important as the physical ones.
Yeah.
And researchers are starting to pay more attention to those factors,
That's good.
which is a really positive sign. It's about seeing the whole person, not just the knee.
And it all comes back to that idea of personalized medicine, right?
It does.
What works for one person might not work for another.
Right.
And what works today might not be the best option 5 years from now.
Exactly.
So it's really about having that ongoing dialogue with your doctor.
Yes.
Reassessing, adjusting the treatment plan as needed. It's a journey, not a destination.
I love that analogy.
Right.
It's a partnership
Yeah.
between the patient and the doctor working together to find the best path forward.
Now, before we get too lost in the future, I want to come back to the present for a second. We talked a lot about PRP, and it's clear it's a promising option. But what about the other treatments? Like, what are some key considerations for someone who might be leaning towards corticosteroids or hyaluronic acid?
Well, for corticosteroids, the biggest thing to remember is that they're a short-term solution.
Okay.
They can provide rapid pain relief,
Right.
which is fantastic for those acute flare-ups.
Yeah.
But they don't really address that underlying problem.
Right.
And it's important to be mindful of potential side effects,
Right.
especially with repeated use.
So it's about using them strategically,
Exactly.
not necessarily as like a go-to first-line treatment.
Exactly. Now, hyaluronic acid, on the other hand,
Yeah.
is known for its safety profile. It's generally very well tolerated with minimal side effects,
Okay.
but its effectiveness tends to be more modest and variable compared to PRP.
And it might take a little longer to see the results.
That's true.
It's not that instant pain relief
It's not.
that you get with corticosteroids.
Hyaluronic acid works by improving joint lubrication and cushioning.
Okay.
So it can take a few weeks or even months for those benefits to fully kick in.
So if you're looking for that quick pain relief, hyaluronic acid might not be the best choice.
Right.
It's about understanding the trade-offs and finding the right balance for your needs.
Exactly. And that's where that open communication with your doctor comes in. They can help you weigh those pros and cons and figure out which treatment aligns best with your goals and your expectations.
One of the things that struck me throughout this whole deep dive is just the incredible pace of innovation in this field.
It really is.
It seems like every day there's a new study, a new technique, a new breakthrough. It's pretty mind-blowing.
It is. Just a few years ago, PRP was considered cutting edge.
Right.
And now it's rapidly becoming the standard of care.
Yeah.
And we're seeing, new refinements and advancements all the time.
Like those different PRP preparation methods we talked about.
Exactly.
It's just fascinating how those seemingly small details can actually have a significant impact on the outcome.
They can.
What other exciting developments are you keeping an eye on?
Well, one area that I'm particularly excited about is the use of biologics in conjunction with these injections. Now, biologics are these substances that are naturally found in the body, and they can help promote healing and regeneration.
So it's like turbocharging the body's own healing mechanisms.
Exactly. And researchers are investigating a wide range of biologics, growth factors, cytokines, even stem cells, to see if they can enhance the effectiveness of these injections and potentially make those results last even longer.
Wow, it's like taking PRP to the next level.
Exactly.
And it's not just about the treatments themselves, right?
Right.
There's also a lot of innovation happening on the diagnostic front.
There is.
Being able to identify and diagnose KOA early on is crucial for getting the best possible outcomes.
Absolutely. Early diagnosis is key because the sooner we can intervene, the better the chances of slowing down the progression of the disease and preserving joint health. And we're seeing incredible advancements in imaging techniques, blood tests, and even the use of artificial intelligence to help doctors make earlier and more accurate diagnoses.
So it's like we're getting a much clearer picture of KOA now than ever before,
We are.
which is really empowering
It is.
for both patients and doctors.
It really is. The future of KOA treatment is incredibly promising, and I'm optimistic that we'll continue to see significant advancements that will benefit patients for years to come.
That is really encouraging to hear. So as we wrap up this deep dive into the world of KOA treatments, what's the one message you want listeners to take away from our conversation?
The most important message is this: you are not alone in this journey.
Yeah.
KOA is a common condition, and there are resources available to help you manage it effectively.
Right.
Stay informed, be proactive, and don't hesitate to reach out to your healthcare providers for guidance and support.
And remember, managing KOA is a marathon, not a sprint.
It is.
It's about finding what works best for you, both physically and mentally, and adjusting your approach as needed.
Absolutely.
We hope this deep dive has given you the tools and the knowledge to empower you on that journey.
I think it has. Thanks for joining us. And remember, stay curious, keep learning, and don't be afraid to ask questions.
Couldn't have said it better myself.
Ah.
Your health is your most valuable asset, so invest in it wisely.